Patrick McKeown, welcome to the Mindful Podcast.
Oh, it's a pleasure. Thanks very much, Dermot. Great to be here.
Absolute pleasure to have you because I really want people to get the information that you've been studying for well over 2 decades. Um, I think it's fascinating, and I guess I feel the same way that that level of frustration that people don't really have this information yet, or maybe they're not aware of the importance and the benefits of breathing. So apparently, we take 20,000 breaths every single day. How many of us are doing them wrong?
It's one of those areas that doesn't get enough attention. And it's not just that there's a lack of general awareness amongst the population, but research only has started coming out the last, say, 5, 10 years. If we
Mm.
look at the anxiety population, it's reported that 75% of the anxiety population, of people with anxiety, that they have breathing patterns that's feeding into their anxiety. So, in other words, it's not just that your breathing changes when you're stressed. If you develop this type of breathing behavior, it feeds into the stress response all the time. In the
So that's massive. I just want to pause there because that's an
mm,
incredible statistic. So 75% of people with anxiety have dysfunctional breathing.
Correct, correct. And I think the word dysfunctional is a terrible word, but even
Mm.
just thinking that, if your breathing is under par, it really has an impact on you. If we think of Here's the other thing. Like when people think about breathing, they have their idea of what does it mean to do breathing. Oh, in through the nose, out through the mouth. Take a deep breath. That's breathing. That's not breathing. We're talking about looking at how an individual breathes from a number of different dimensions and then improving it based on that. And that's really when you get the full potential of what breathing involves.
Mm. So if breathing was a sport, how unfit are we all at
Oh,
this
pretty
level?
bad. Pretty bad. We're couch potatoes, so we are.
Yeah.
There's going to be similarities because like our breathing is so susceptible. We have a personal relationship with our breath, and so many things will affect our breathing. Even what's going on in the mind. The group of people who are most prone to poor breathing patterns are people with perfectionist tendencies. And that's when they set high demands on themselves. And of course, the body doesn't know the difference between a real event, something that's happening on the outside, or an imagined event, something that's going on in our head, but yet our breathing can respond. For females, hormonal changes change breathing patterns. And females can go through symptoms that are associated, especially PMS, associated with, to the point that some researchers have said, could the symptoms of PMS be the symptoms of dysfunctional breathing, or more accurately, the hyperventilation syndrome? So your genetics influences. If you're talking all day, many of the listeners here, they may have jobs that involve talking, then they know that they're quite tired at the end of the day. Lack of exercise, too many factors, yeah.
Yeah. What would you say is the biggest myth about breathing?
Oh, take a deep breath. Oh my God, it drives me mad.
Why is that?
It does because, it's everywhere. Like if I watch, there's not a day that doesn't go by. If you're watching something on Netflix or if you're listening to something on radio, and even I've heard on national radio here in this country too, you're stressed, take a deep breath. Or you're
Mm.
stressed, breathe. Like, and where's it all? What does the word deep mean? Like sometimes people think that if you take this big full breath, you've got increased blood flow, increased oxygen delivery to the brain, and a calming effect. And that's simply not correct.
So if somebody is in a high stress state and you weren't going to say to them, take a big deep breath,
Yes.
what would you be saying to them if they were beside you?
Do the opposite to how you breathe when you're stressed. When you're stressed, you breathe faster, you breathe harder, you breathe upper chest. I would say what I do. Like I go into challenging situations, you go into challenging situations, and if we feel that our heart rate is a bit too elevated, automatically we know that we don't want to go into these situations with an elevated heart rate because then we're in survival mode, we're in fight or flight. We're just not going to say the right thing. You're not going to access that flow. So it's not only that you're in a stressful state, you're not at your best in terms of performance. So
Mm.
how do we de-stress? With the breath, it's very direct. Breathe the opposite to how you breathe when you're stressed. Breathe in and out through your nose, not in through the nose and out through the mouth. Take a soft breath in through your nose and a nice slow and relaxed and a gentle exhalation. You don't breathe that way when you're stressed. You breathe in fast, you breathe out fast. It can be a hard breath or you stop breathing. We want to have regular breathing. So, and people can check this if they identify or if they just locate their pulse, just at say the angle of the jaw, and then they pay attention to their breathing. So they check in on how fast is their heart rate and can they slow down the speed of their heart rate by changing their breathing patterns. And I would say for people to experiment, what works best for you. But that last exercise is likely to work best because it's just based on stimulating the vagus nerve. You're taking a soft breath in through your nose and you're having a relaxed and slow, gentle breath out. And the thing is, Dermot, there is nothing for anybody to see. We don't want to give the game away. This isn't going to be on Instagram because there's nothing to see. But the last thing that I want going into a challenging situation is to be standing doing some hyperventilation or something outside the front door. And then people say, oh my God, he must be stressed. No, no. I want to go in there fully composed. And if I do feel a bit stressed and my heart rate's a bit elevated, I know that I can bring down the speed of my heart rate. Now, the fact that you know you can do it gives you a degree of confidence that's going to take the stress from you because very often the stress is the unknown of going into the situation. So there's a comfort in knowing that, yes, you can put yourself into that challenging situation because even if you feel a bit stressed, you've got some control over it. Every kid, every adult should know this. How many children are going to do the Leaving Cert? They're going to go in, they're a little bit stressed, and it impacts their performance because you don't get to that state of mind whereby the information is going to come out fresh and original thinking. We need to have a balance in the nervous system. A certain amount of stress is good, too much stress is bad.
Mm. Talk to me about our nose.
Oh, it's a wonderful organ. What do you want to know about it?
Well, I know in your wonderful book, The Oxygen Advantage, you say your nose is for breathing, your mouth is for eating. But I was at the gym this morning and every single person in there was definitely using their mouth to breathe and quite heavily. Now, I know that's kind of an extreme situation in the gym. People there's a lot of exertion going on. But I get the sense from you, if you could fix one thing about the way we breathe right now by waving a magic wand, you'd get everybody simply to breathe through their nose. Am I right?
Yeah, and even during exercise, because there's nothing inside the mouth. We should always consider the mouth as an emergency and treat it that way. And even if you've got a head cold, by holding your breath, you can decongest your nose to open your nose so that you can still breathe through your nose. There's nothing inside the mouth that does anything for breathing. If you go to a mirror, you open your mouth and you look inside and you see, okay, what's inside my mouth? My teeth, my tongue, my gums, my hard palate, soft palate. So you've got the roof of the mouth, the floor of the mouth, the back of the mouth, and inside there you have tongue, teeth, gums, saliva. Nothing there for breathing. So in terms of respiration, it's an emergency. Everything is inside your nose. And the nose has a minimum of 30 functions when it comes to respiration. And even those individuals in the gym, many of those people will be walking or light jogging, zone 1 and zone 2 physical exercise, having their mouth open. Absolutely no need. If they breathe it through their nose during exercise, they will have increased blood flow to the heart, increased blood flow to the brain, increased oxygen delivery throughout the body, better recovery post-physical exercise. They're protecting their airways. They're adding an extra load onto the diaphragm. They're breathing lower. The diaphragm, of course, is providing stabilization of the spine, and they're also helping to improve their everyday breathing patterns. It's just a no-brainer. It's a no-brainer.
Mm. When we mouth breathe, which a lot of people fall into the habit of doing, are we over breathing? And what effect does
Yeah,
that have on our nervous system?
very little research, unfortunately, on this. And I even checked this yesterday because automatically you would assume that if you have your mouth open, you tend to breathe faster. There's no question because with mouth, there's a bigger space for air to come in and out. So there's less resistance to your breathing. So you will have a faster respiratory rate when you breathe out through your mouth. Also, the other thing that we have to consideration is the ratio of the breath in to the breath out. So if we're mouth breathing, we typically take a sharp breath in and a sharp breath out. Sharp breath in and a sharp breath out. We typically breathe more upper chest. So that comes back to your question in terms of the nervous system. If we breathe fast, mouth, upper chest, our body is telling the brain that there's a threat. So it's putting the nervous system into that increased stress response. But another factor associated with this is sleep. Many people breathe through an open mouth during sleep. They don't get the same adequate deep sleep that they should be getting. They're more likely to wake up feeling unrefreshed. They're also more likely to wake up during the middle of the night, maybe to go to the bathroom, and more likely to snore, having obstructive sleep apnea. So that's going to affect the nervous system. You know, if we think about the benefit of sleep in terms of deep sleep, and we're talking about slow wave sleep here, not just stage one, which is light, and stage two is light sleep. We're talking about stage three sleep. We need adequate stage three sleep because this is where the brain cleans itself. If we're not getting adequate stage three sleep, for children, it affects brain development. But for adults, it could lead to a buildup of different toxins such as amyloid beta, which can be implicated then in cognitive decline in latter years. So, nose breathing during sleep, and I'm not talking about forcing the mouth closed to breathe through the nose. I'm talking about adopting nasal breathing both during the day, during rest, during light physical exercise, nothing forced, and also during sleep. So, when we look at the nervous system, how you breathe is going to have a direct impact on the nervous system. And if we want to help dampen the stress response, we always have to consider breathing in and out through the nose, regular breathing, good recruitment of the diaphragm, and a soft inhalation with a natural and slow exhalation. The exhalation, the ratio of the exhalation should be about 1.5 times the length of the inhalation. That doesn't happen with mouth breathing.
Mm. So we naturally have a longer exhale when we're breathing through our nose.
Yeah. And
Mm.
anybody can test this. Like I will always say to my students, look down at your chest, take the breath through the mouth, and they will typically see that their breathing is faster, it's sharper. They have a fast exhalation. So it's not just the speed of the inhalation. When we think about relaxation, we really have to think about the speed of the exhalation. And if I want to tell my brain that everything is okay and that my body is safe, all I have to do is take that soft breath in through my nose, nothing for anybody to see, and that slow, relaxed, gentle exhalation.
Mm.
But
I think that's,
this might come back to, sorry,
yeah, sorry.
this
No,
might come
go
back
ahead.
to, this might come back to your original question. So when you asked then about people who are mouth breathing, these individuals, again, there's no definition of what constitutes mouth breathing. Is it when you have your mouth open 5% or 10% or 20% or 50% of the time? I knew as a child and teenager growing up, my mouth was open chronically. And 25 to 50% of studied children, they are persistently breathing through an open mouth. We have very little research on adults. And the reason being is because obviously it's a topic not worth researching in the minds of the researchers. But I will say this, anybody who is persistently breathing through an open mouth, we don't reach our full potential. Our sleep is impacted, our concentration is impacted, our cognitive function is impacted, our mood is impacted, our dental health is impacted. Like there's many kids going into dentists now, say this week, teenagers, adults. The dentist will say, oh, you've got increased dental cavities. You have dental caries there. You have inflammation of your gums. The dentist will say, brush your teeth and stop eating sweets. But is the dentist going to say to that child, I need you breathing through your nose? Because if you breathe through your nose, you've got increased watery saliva in your mouth. And with increased watery saliva in the mouth, it's protecting your teeth, it's protecting your dental health. But if you're breathing through an open mouth, that saliva dries up. And as a result, it alters the pH and it alters the microbiome inside the mouth. And there's an increased then plaque index, increased bacteria. And of course, the bacteria then in the mouth, when we swallow, we carry that into the stomach. So every dentist, it's absolutely insane that dentists do not know the importance of nose breathing for dental health because it's just normal physiology. You know, your saliva is there and it serves a purpose. Now, I'm going to say this, some dentists get it, but 95% of them don't.
Orthodontists, I guess we can put into that group as well. I know that just from dealing with orthodontists that I've gone to over the years, my kids have gone to, some would be fans of removing just teeth to kind of make more room and be able to bring some movement into them. But there are others that, for instance, had my son taping his mouth at nighttime. And he was more concerned about the position that my son's tongue was in his mouth, which I hadn't heard before. But I guess this ties into what you're talking about. Can you explain that a bit?
I think it's amazing that your orthodontist was encouraging nasal breathing. So there's two schools of thought. One school of thought is that if a child has overcrowding of teeth, the problem is that the teeth are too big. And one theory would be it's all about genetics. So the child has inherited dad's big teeth and mom's small jaw. Now, that's to the point that there was a book written back in the 1980s by Hal A. Huggins, and a terrible title. The name of the book is Why Raise Ugly Kids. And he said that he worked on a farm. And as a kid growing up on a farm, they would cross different farm animals. And he said, I never seen a mule with big teeth and small jaw. So like genetic influence is some influence, but it doesn't have the degree of influence to what is commonly thought out there. Okay, so going back to that school of thought, if the teeth are too big, the way to solve it then is to remove teeth. So you pull 2 or 4 teeth, and then you straighten the rest of the teeth, and then you have perfectly straight teeth, but it's doing nothing for the jaw. The other school of thought is it's not that the teeth are too big. The problem is that the jaw is too small. And I'm talking about typically the maxilla. Now, of course, the mandible can be impacted, but the maxilla. So this is the top jaw. We want the top jaw to be nice, round, and U-shape. And that shape is directed by the shape of the tongue. So a child that's growing up with the mouth closed and the tongue in the correct resting posture of being in the roof of the mouth, the pressures exerted by the tongue in the roof of the mouth help to direct not only the width of the jaw, but also forward growth of the jaw. So now this jaw is well able to house all teeth. And there should be no reason that we cannot house 32 teeth. A narrow jaw and overcrowding of teeth is telling us that the problem is that the jaw is too small. If the jaw is too small, there's no room for the tongue. If there's no room for the tongue is more likely to encroach the airways. If the child doesn't have the width of the maxilla or the forward growth of the maxilla, they have a narrower airway. And if they have a narrower airway, they are more susceptible to obstructive sleep apnea for the rest of their life.
Wow. So, how are teeth and jaw and tongue placement develop as children can have far-reaching implications for our health later in life. Like you say, sleep apnea. Let's talk about sleep, because it's such a huge issue for people. You know, my latest book was busy and wrecked, and a lot of the wrecked part is because people's sleep is not what they want it to be. But I don't think that the way they're breathing is top of mind in a lot of the literature, obviously aside from your own. And that's why it's so important to talk about today. So, talk to me about the importance of how we breathe and how we sleep.
One of the founding fathers of sleep medicine is the late Dr. Christian Guilleminault, and he was a Stanford-based physician. And our paths had crossed many times at different conferences in the United States. He would be talking about the airway. I was talking about breathing. I had several dinners with him and even over a glass of wine. And always his emphasis said, we must teach our children the importance of breathing in and out through the nose. And it wasn't just children, it was adults too. He also said that if a child has adenoidectomy, tonsillectomy, but if they continue mouth breathing post-surgery, they will have a relapse in their sleep. So here we have one of considered the top sleep doctors in the world. He coined the phrase obstructive sleep apnea. He also came up with the apnea-hypopnea index. He also developed, or he coined, upper airway resistance syndrome, both in children and adults. So this person is really influential in sleep. He has been talking about the importance of nose breathing, but it hasn't trickled down. Matthew Walker wrote a book, Why We Sleep. There wasn't one mention of nasal breathing, which was very surprising, based on if we have our mouth open, the mandible is in the lower back resting posture, and the airway is naturally narrower. And if there's any resistance, so if you narrow that pipe, if that pipe is narrow, it takes more work for the air to flow from the nose or mouth into the lungs and back out again. And if the resistance is high enough that the airway partially collapses or totally collapses, well, then not enough oxygen is going to get into the body. And with that, then, the brain is going to take that person out of deep sleep. Now, when we talk about obstructive sleep apnea, It is quite common. 936 million people are estimated to have it on the planet. And that's according to a Lancet review back in 2017. But only 15% of people know that they have it. So only 15% of people get diagnosed. And of that 15%, 40% take up treatment, which is a CPAP, continuous positive airway pressure machine. And of that, only 50% of people stay with it. So here we have a sleep disorder that is so common that it really can have an impact on our health in a negative way. And we also need to realize that females sleep differently. They don't just breathe differently to men, but females also sleep differently to men, and they're more prone to what's called upper airway resistance syndrome.
Patrick, you mentioned there that men and women sleep differently. Could you just expand on that a little bit?
Yeah, this is something that's probably only came to attention again in recent years. For a man, when he has a sleep disorder, it's pretty obvious. The classic example is he's snoring his head off, and then there's total silence. He stops breathing. So when he does a sleep study, it will be pretty obvious if he is stopping breathing during sleep, and then the doctor can diagnose whether he has obstructive sleep apnea or not. For a female, it's quite subtle. So for a female, she can be more prone to, because of the narrowing of her airway, it increases the resistance to her breathing. So it's more difficult for air to flow from the nose, say, into her lungs and back out again. And it's the increased effort to breathe that takes her out of deep sleep. But when she does a sleep study, she's not necessarily stopping breathing. Her blood oxygen saturation isn't necessarily dropping. So the pointers that you would see so evidently in a man are not present when the female does the sleep study. Now, the risk there is that if the doctor doing the sleep study is only looking at apneas or hypopneas or blood oxygen saturation and not looking at respiratory effort-related arousals, that doctor may say to the female, "You've got good sleep. There's nothing wrong with your sleep." And she knows that she doesn't have good sleep. And there's very often an anxiety component present in females, and also what's called low arousal threshold, that females have a propensity to wake up easier during the middle of the night. So it is much more complex. But again, it points to a number of different things here, because even if we think about the airway, how you breathe in your everyday is going to impact your airway and breathing during sleep, but also your nervous system. So one argument would be with people who are waking up quite frequently during the middle of the night. Now, it's not necessarily insomnia. Low arousal threshold is when there's an issue with your breathing, and that could be enough that you just wake up easy. So with that, then, it can be that the nervous system is implicated. Now, of course, there's a vicious cycle here. If you have poor sleep, your nervous system is in an increased stress response, but the increased stress response from the poor sleep isn't just isolated to poor sleep. That increased stress response carries into the day, and that increased stress response carries into the next night of sleep. So again, the question to ask is, if one has a nervous system in that increased stress response, what might be quite a direct way to influence that? Now, normally with people with low arousal threshold, if they're waking up quite easy, they're prescribed sedatives. But sedatives, while they can work, they also carry side effects. And that's why they may not be the best. If they're necessary, absolutely. But if somebody can be looking to improve their sleep quality, aside from using sedatives, it would be a great way to go.
Hmm. I want to put something on right now.
Mm-hmm.
And this might seem strange to people who don't know you and your work.
Sure.
Like I'm trying to get a Craig David goatee or something from the 90s. I've just put moisturizer on now, so it's not sticking properly.
Oh, it's
But
well done. It's no wonder you're looking so young, Dermot.
could you explain what your myotape is all about?
We were encouraging nasal breathing since the late 1990s. And with all of my clients over the years since 2002, encouraging nasal breathing during sleep. But the tape that we were good tape, but it covered the mouth, and it wasn't ideal because there was some degree of perceived risk. and some small degree of risk, even though the risk was minimal. I came up with myotape about 5 or 6 years ago, and myotape is a tape that brings the lips together. It surrounds the mouth, but it doesn't cover the mouth. So it's a safe way to bring the lips together. So mouth taping now, it's gone viral. People are aware of it. You know, a lot of teenagers, social media, they're really getting behind. Teenagers, of course, are interested because they know that when they have their mouth closed with their tongue in the resting posture, it helps with the development of the jaws and they look stronger, they look better. But of course, the big thing about nose breathing during sleep is waking up feeling refreshed. And for me, that was a game changer. Any of us in these fields, and your story is quite similar, we didn't fall into mindfulness or breathing just by fluke. It wasn't just by an accident. The vast majority of any of us in this space, we always came into it because of our own personal issues first. We used a particular approach to help solve our issues. And from that, we realized there's something in this. It really works. It drove our interest and we wanted to get the information out there. So for me, I had poor sleep, waking up with a dry mouth, chronic stuffy nose, poor concentration, and everything that comes to that. And I can remember, and this again is about 26 years ago, 27, it's going back a bit. I remember the day I wore a nasal dilator across my nose to keep my nose open. I did the nose unblocking exercises from the Buteyko method. I taped my mouth closed. And the first morning waking up, I don't kind of remember that much of a difference, but I kept on nose breathing that second day. And I taped up again that second night using a nasal dilator. And I will genuinely say, Dermot, the difference in my night's sleep was unbelievable. I woke up with a sense of refreshment, knowing that I had a really good and deep sleep and being able to focus. And, you know, it just struck me. How did I get through my school years? How did I get through my university years? And I reckon now it could have been a lot easier because if you have a child or a teenager who is going through academia, if that child has got poor sleep quality, they're going to find it tough and they will have to work very hard.
Mm. You mentioned some techniques there. I'd love maybe towards the end of our chat, if you could just give people one or two exercises.
Of
Perhaps
course.
the nose unblocking one, I think, is an amazing one. That blew my mind. I was like, wow, I can clear my nose whenever I want. Why didn't
Sure.
anyone tell me this? You know, because a lot of people, as you say, just feel congested a lot of the time and they don't know, particularly before exercise, that you can
Yeah.
in a few seconds can totally transform. So we'll come back to that and maybe one or two of your favorite techniques just for getting people started and getting them thinking in this way of frame of mind. But CO2, carbon dioxide, is such a pivotal part of the conversation that you have around how we breathe and why we breathe the way we do and how we can breathe better. Can we go into a little bit of the science, just bearing in mind that I am not a biology student or expert? So, how would you explain the role of CO2 and how we can use it to our advantage?
Yeah, carbon dioxide, it's a gas that's produced internally in the body. So we produce it. We're not breathing it from the outside in. We produce it as a byproduct of the metabolism. And the carbon dioxide gas is going from the tissues in the blood back to the heart and back to the lungs. We need to breathe out about 15% of the gas. We need to hold on to about 85% of it. So there's always carbon dioxide in our lungs, but we need a certain pressure of carbon dioxide in the lungs because it's the pressure of carbon dioxide in the lungs that determines the pressure of carbon dioxide in the blood leaving the lungs. If we have normal carbon dioxide in the blood, we have good blood circulation. We also have good oxygen delivery in general. And the reason being is because carbon dioxide is a vasodilator. But also, when carbon dioxide increases and blood pH slightly drops, hemoglobin, which is the main carrier of oxygen in the blood, releases oxygen more readily. So most people, when they think about breathing, they think about oxygen. But whenever you want to think about oxygen delivery, you have to think about carbon dioxide because it's carbon dioxide that's going to influence your blood circulation. And it's carbon dioxide that's going to influence the ability of hemoglobin to release oxygen. There's no point in hemoglobin, which is a protein within the red blood cells. There's no point in oxygen going from the lungs into the blood and that blood to do a round trip and we breathe that back out again. You know, we don't bring in oxygen to breathe back out oxygen. We breathe in oxygen for oxygen to be delivered throughout the body. And one of the main factors that causes oxygen to be delivered throughout the body is carbon dioxide and the effect it has on pH. So if you do physical exercise, you produce more carbon dioxide. And the carbon dioxide in your blood is influenced by one thing only. That's the volume of air that you breathe. It's not just the respiratory rate. People often think, well, if I slow down my breathing rate, it means that I'm breathing less. That's not correct. You could breathe slower, but you could take full breaths and you could actually breathe more air. What we're looking at is the volume of air that you breathe per minute. And this is determined by the respiratory rate multiplied by the volume of air that you breathe with each breath to give you the volume of air that you breathe per minute. And if you have a habit of breathing a little bit too hard and a little bit too fast, you blow off too much carbon dioxide. So too much carbon dioxide is removed from the lungs and it's breathed into the atmosphere. With too little carbon dioxide in the lungs, there's going to be a reduced reduction of carbon dioxide in the blood leaving the lungs, and as a result, then blood vessels constrict. A telltale sign of this would be people who have cold hands and cold feet. Very often, it's because of overbreathing and hyperventilation syndrome. This isn't when somebody is having an acute panic attack or hyperventilation attack. It's just that breathing is just a bit heavy and a bit faster than normal. That's all it takes. And if you think of the 50,000 miles of blood vessels throughout the human body, whether we have those blood vessels nice and open or we have them some way constricted is going to be influenced by the volume of air that you breathe. Now, despite this dermot, I would love to see the day that students of yoga go to a yoga practice and the yoga instructor encourages the students to breathe a little bit less air, not just slow down the breath, but breathe a little bit less air, at least during some of the practices. Breathe nose in and out. Breathe a little bit lighter. How do you know that you're breathing a little bit less air? You have an increased sensation of air hunger. But it's not that it should be stressful, just a bit of breathlessness. Because of the increased air hunger tells you that carbon dioxide is increased in the blood. Because ultimately, the primary driver to breathe is the gas carbon dioxide, not oxygen. So it's not that oxygen is dropping that we need to take in a breath. It's the carbon dioxide increases just a little. That's when we need to take in a breath. So the brain is monitoring primarily carbon dioxide and resultant blood pH. So the other thing about carbon dioxide is how sensitive we are to this gas will influence how fast and hard we breathe. And if we can reduce the sensitivity of the body to carbon dioxide, we naturally will have lighter and slower breathing. And with lighter and slower breathing, and I'm talking about bringing it towards normal. I'm not going from normal to be slower than normal. No, I'm just saying that it's quite common for many of us because of the lives that we live, that we breathe just a bit faster. We breathe just a bit harder, a bit irregular, and a bit upper chest. And that's going to keep us stuck in that increased stress response, impacting our sleep. And also, we often feel we're not getting enough air. We can have disproportionate breathlessness during physical exercise. Our recovery isn't good. So there's so many factors affected by it. But the biochemistry of breathing has often been forgotten about. A lot of the emphasis, it's all about the biomechanics. The diaphragm, of course, it's an amazing muscle. It's the primary breathing muscle. So the biomechanics, really important. But don't forget about the biochemistry, because if you can get your biochemistry right, you're influencing your blood circulation, your oxygen delivery, your nervous system, your sleep, your airways, and smooth muscle throughout the human body. You don't want to have abnormal breathing from a biochemical point of view. That one is going to catch up with you.
Okay, so by developing a tolerance to carbon dioxide in our body, we
Mm-hmm.
start to breathe more efficiently. We get more of that lovely oxygen into our bloodstream, and we get all the benefits to our nervous system and for fitness and everything that brings with it.
Mm-hmm.
So let's do a little, tell us the techniques where you would start somebody if they came to you. They knew that maybe they were doing more mouth breathing than they'd like to. Maybe they were snoring, uh, think they might have sleep apnea. Maybe they just want to be fitter in the gym and win the next High Rocks event or whatever it happens to
Sure.
be. So
Sure.
take us through a couple of your favorite exercises. Maybe we'll start with that one about clearing your nasal airways and actually setting us up in a position where we can breathe more easily through our nose.
Oh, yeah, totally. The thing about the nose and blocking exercise, we are going to hold our breath.
Mm.
And when you do a breath hold, start off easy because when you hold your breath, it builds up air hunger. And some people listening may be just a little bit sensitive to the air hunger and you don't want to feel panic. So that's why go easy and just build up, yeah? So the nose unblocking exercise, don't do this if you're pregnant. If you have any serious medical conditions, you have to go very, very gentle. So I'm going to start off gentle. You take a normal breath in through your nose and a normal breath out through your nose, and you pinch your nose and hold your nose, and you just gently nod your head up and down, holding your breath for about 5 head nods, and then to let go, but to breathe in through your nose. And then you let go and breathe in through your nose. And then we wait about 20 seconds, 30 seconds, and then we will practice it again. So we do a few easy ones first, and then we build it up. Anytime that you have nasal congestion, you never just have a stuffy nose, your sleep is likely to be impacted. And if your sleep is likely to be impacted, your state of mind is impacted. So let's go again. Take a normal breath in through your nose and out through your nose, and pinch your nose and hold, and just gently nod your head up and down, this time for 7 head nods. And then you let go, but you breathe in through your nose. Normally with 5 or 7, you may not feel a whole lot, but we will increase it to 10. And even with young children, I've taught this exercise to children from 4 and 5 years of age onwards. Now, of course, with a young child, they may have an issue with the adenoids at the back of the nose. But one way of getting an indication of that is we have the child do the nose and blocking exercise, and then we check, can the child breathe comfortably through their nose for 3 minutes? If the child can breathe comfortably through their nose for 3 minutes, well, then we know that the child can breathe through their nose. But if the child cannot breathe comfortably through their nose for 3 minutes, even though they've done the nose and blocking exercise, we may suspect that the issue is the back of the nose. And that's where a referral to their doctor is necessary. So how about 10
Mm.
head nods? Take a normal
Okay.
breath in through your nose and out through your nose, and hold your nose and just gently nod your head up and down, holding your breath for 10 head nods. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And then to let go, but to breathe in through your nose. And we gently then push it to 15 to 20 head nods. It could even be 25 head nods. So it works if you have a congested nose, and some people, if they're constipated, they can give it a go as well. And it can have other benefits too. It's helping to shift mucus from the lungs. It actually increases blood flow to the brain. You know, if there was a lot of thought activity going on in the mind, sometimes it needs a little bit of a sharp shock just to quieten the mind. So a breath hold can be useful. And, but again, it's doing it within limits. We want to challenge the system, but we don't want to overdo it either. Do you want to do
Mm.
one more?
Yes, please.
So, how about 15? So, whenever you're ready, take a normal breath in through your nose. So, it's a normal silent breath in through your nose and a normal silent breath out through your nose. And you hold your nose, just gently hold your nose. And then you're just gently nodding your head up and down. And that's number 2 and 3, 4, 5, 6. You surrender into the breath hold. 8, 9, 10, 11, 12, 13, 14, and 15. And then just to get your breathing under control, and it seems fine there. And the other thing is, people who don't have great breathing, they typically won't be able to hold their breath for all that long. So that can be also an indication. Now, we do have a more precise measurement called the body oxygen level test. But even if people are practicing that nose and blocking exercise, people with good breathing will be able to hold their breath relatively comfortable for 15, 20, and even 25 head nods.
Mm. Any other exercises people could start to introduce?
One of the best breathing exercises in the world is go for a walk with your mouth closed. Do your yoga with your mouth closed, breathing in and out through the nose. And people often say, like, Why breathe in through your nose and out through the nose? Well, when you breathe in, your body has expended energy in preparing that air before it comes into the lungs. Your nose warms up the air and it moistens the air. When you breathe out through the nose, you naturally have a slow, relaxed exhalation to allow the diaphragm to move back up to its resting position. But also, as you breathe out through your nose recovers the heat and the moisture from the exhale breath. So there's an energy thing going on there. It really doesn't. I'm never sure why there's so much emphasis on breathing in through your nose and out through the mouth. I understand with pursed lip breathing, it increases pressure inside the alveoli to help open them. I understand that during physical exercise, the intensity of exercise might be quite strong. And a way to alleviate air hunger or to get rid of the feeling of air hunger is to breathe in through your nose and out through the mouth. Okay. But in normal everyday, breathing in and out through your nose, going for a walk with your mouth closed, breathing in and out through your nose, any sort of movement in and out through your nose, it's a brilliant exercise. It's never just a training for the body. And as you're doing your movement, of course, we always say get your attention out of your head and onto your breath and into the body, and then we're moving into your space because we're having our attention on the breath. And that's a tremendous way just to help to bring a quietness to the mind, a little break between the thoughts, to break the momentum of thinking, because God only knows. I don't know how people do it, Dermot. And this comes back to our question earlier on. Awareness of breathing patterns. There's a huge change in the last 5 years. Now, I mean, like, we have 18 staff here on the west coast of Ireland, and we have about 10,000 instructors worldwide. So there's definitely a huge change happening. But I genuinely don't know how people often get through their days. I really don't, because breathing is a tool, and breathing and mindfulness have a lovely crossover. Because with breathing, you have your attention on the breath, but then you're going beyond having your attention on the breath. You're actually changing your breathing. Number one, to improve your everyday breathing. Number two is to improve your sleep quality. Number three is to increase blood flow and oxygen delivery to the brain. And number four is to reduce brain cell excitability. And that is a tremendous that you can use, and everything then throughout your day is that little bit softer. So while people think about breathing, they say, oh, take a deep breath. It's not even scratching the surface. Breathing in for 4, holding for 7, out for 8, it's not even scratching the surface. Or breathing in for 4 and out for 6. No. The only way to understand about breathing is, you're making progress with your breathing if your breathing is moving from a stress state over to relaxed. So we talked at the very start that when we are stressed, our breathing gets faster, harder, upper chest, irregular, often through the mouth, and it feels an effort to breathe. Any breathing practice that anybody should be doing, if you're doing a breathing practice, always ask your question, is this breathing practice improving my underlying breathing pattern? And one way to identify that is your breathing practice moving you from the left, from faster breathing to slower, from harder breathing to lighter, from irregular breathing to regular breathing, from mouth to nose, and from chest to better recruitment of the diaphragm, from effortful to effortless breathing. And the more that you're moving over from one to the other, then you're making a real impact, because that's your everyday breathing. Now, of course, when you improve your everyday breathing patterns, you've got a great foundation. You're more resilient, even though I'm not sure if it's a great word, but you're better able to cope with the ups and downs and the little things that happen in our life, and sometimes the big things, unfortunately, that can happen. You just have that tool to make things a bit softer. And also in the moment, if, for example, you're going to make that public presentation, which can be very unnerving for people. Like, I've been out on stage or going in to do a job interview, my heart, even though of course I practice all of this stuff, my heart rate is elevated. And I use breathing in that moment just to bring down the speed of the heart rate. So that might lead on then to my next favorite exercise. The most accessible exercise in the world that we spoke about is the one that we did at the very, very start. Tell the brain that you're safe. That's all the brain wants. How do we tell the brain that we're safe? Well, don't breathe the same way as you would breathe when you're stressed. And it kind of reminds me, I was listening to Dr. Rangan Chatterjee. So he's a doctor in the UK who is quite well known as a celebrity doctor. And he was interviewing Dr. Rahul, who's a brain surgeon. And you can imagine Dr. Rahul, that's a pretty high pressure job, looking into somebody's brain of a Monday morning. I couldn't even think of it. But he said, he said, when I get into a tricky situation, the first thing I do is prevent myself from hyperventilating. And I just said, this is amazing. Here's a brain surgeon. When he gets into a tricky situation, you can be sure this is a tricky situation. This is life or death. The first thing he says, nothing, not the second, the first thing he does is prevents himself from hyperventilating. Now, he's not talking about having a panic attack over the patient. He's talking about recognizing that his breathing has got a bit faster and harder, probably a bit upper chest. And he knows that if he goes into that state, he's not going to make a good decision because now his brain is going into survival mode. We should all know that. The young child going into school, the person in the workplace, you could be, approaching every now and again. There's a few awkward people out there, and you have to approach an awkward individual. You have to make an awkward decision. You might feel a little bit tense about it. Don't go in too tense because you're not liable to make a great decision in that instance because you're going into the fight or flight. Simply take a soft breath in through your nose and a relaxed and a slow and a gentle breath out. You don't have to time it. And the reason that I would say that is if I was to say breathe in for 2 seconds and out for 3, or breathe in for 4 seconds and out for 6, while that may suit some people, it won't suit everybody. So tailor it according to how you are breathing at that time. All you have to do is soft breath in through your nose, just gentle, soft breath in, and a relaxed and slow, gentle breath out. It's silent, it's calm, it's gentle, and it's soft. Don't wait for the challenge before you start doing it. Start doing it when you feel a little bit antsy during the day, just as my Wi-Fi here is dropping. So you feel a bit antsy, that's the time to start doing it. All the little things that happen during the day, you bring your attention onto the breath, you get your attention out of the head, and you're telling your brain everything is okay. And then when you need it, it's there for you. Such a simple exercise. Now, you could go one step further. So this is another exercise. As you take a soft breath in through your nose and a really relaxed and slow, gentle breath out, you could soften your breathing just a little bit more. And soften your breathing to the point that you feel a slight air hunger. Now you know that carbon dioxide has increased just a little in your lungs and blood. And as you practice that exercise, check in on the saliva in the mouth. Generally, you will notice that you will have increased saliva in the mouth, which is indicating that the body is ready for digestion of food. So you know that you're activating that response. You might even feel a bit sleepy, but the thing that got me into breathing was the 2 exercises. The nose unblocking exercise because it worked, and also the soft and light breathing in terms of a really soft and slow, gentle breath in and such a relaxed and slow, gentle breath out to the point of air hunger. How did it get me into breathing? Because the temperature of my hands and my feet improved, but I also felt calmer. I never realized you can increase blood flow to the brain by between 5 and 10% by breathing a little bit less air, not by breathing more air. Any of the listeners will realize they have in the past, they could have taken slow, full breaths. They're following an instructor. The instructor is saying, I need you to breathe in for 4 and out for 6. You hear people in the room breathing and they may feel a little bit lightheaded. You might have been breathing slower, but you were breathing too much air. That's not going to increase oxygen delivery to the brain. That's going to have the opposite effect. If you want to improve blood circulation, if you want oxygen delivery to the brain, and if you want to improve your everyday breathing, you have to think about carbon dioxide. And how do you do that? If you breathe a little bit less, and I'm not saying breathe less like this all day long. This is not what that's about. And I'm not saying never take a full breath. All I'm saying is match your ventilation with your metabolic needs. It's the same as food. Don't undereat, don't overeat. The same with breathing. Don't underbreathe, don't overbreathe. Many of us have a tendency to overbreathe. Many of us have a tendency to overeat. We develop habits, and all we're doing is looking to bring that back towards normal.
Is it normal when you start to nasal breathe more, particularly during exercise, to get a really runny nose?
It is. Yeah, and it doesn't, sometimes it continues as well. So that
Yeah.
could be for the experience as well, you know. Like it may be because as you're doing physical exercise with your mouth closed, there's a lot more air coming into your nose. Like the respiratory rate could increase to 30, 35 breaths per minute. the tidal volume could be 2 liters. So you're exchanging 70 liters or 80 liters. And if you were to do really high intensity, and we don't recommend doing maximum intensity exercise with your mouth closed, there's a time at which you do have to switch to mouth breathing to alleviate the sensation of air hunger. But yeah, if you think of the human lungs, normally at rest we're breathing maybe about 14 breaths per minute. And each breath we are taking in a half liter into our lungs. So 14 by a half liter gives us about 7 liters. If you're doing high intensity physical exercise, you could be breathing 50 breaths per minute. And each breath could be 2 liters or even 3 liters, depending on the person. So we breathe a range of between 7 liters during rest to as high as 150 liters a minute and everything in between. Now, at some point, when we're going from nose, 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 the air hunger gets too much, we switch to mouth. But as we increase the intensity, the speed and depth at which we breathe, irritant receptors start secreting more mucus, and it's normal. So you just have to blow your nose. So yeah.
Yeah, and I remember from your book that it can be normal for people to experience some detox symptoms when they
Yes.
begin nasal breathing a lot, and not to freak out basically if they start to experience some kind of detoxy symptoms.
Yeah, and it'll depend. It's not just even nasal breathing, but it's also in practicing breathing less air and breathing light.
Mm.
Um, so say what would be the typical symptom there might be you might have insomnia from one night or 2 nights. You might have a head cold, so it's nothing really, there's nothing major with it. But at the same time, I would say don't let that put you off. If you change your diet, your body will go through a transition. I can remember having a coppery taste in my mouth as a result of making real changes there. It was, and I'm not sure what was going on there. So there was different effects that were happening. I remember working with a client and she was on a lot of asthma medication. So she would have been taking oral steroids. And she came in to me a week later and she says, I absolutely stunk during the week. And the reason being is because it seems that the medication was coming out through her skin. And so it's just one of those things, like if we think about the powerful effects of breathing, we can open up our airways. We talked about the nose earlier on, but your nose and lungs are linked. Okay, that's one effect. We spoke about improving our blood circulation. We spoke about oxygen delivery. There's also a gas, nitric oxide. That's when we breathe through our nose, we harness that. The nervous system. You know, is there any other technique or anything else in the world, anything else that we can do that can have such a wide-ranging effect? And with that, then, of course, yes, you can go through a little detox. But again, it's mild. Never anything to put anybody off from doing the practice.
Well, Patrick, we're so glad you're there and letting us know all about this fantastic information that's right there for us if we're willing to reach out. Obviously, people can pick up your books, which I'm going to tell everybody about now. And what is the best place to find you online?
If it's health, Buteyko Clinic, that's Buteyko clinic.com. And that would be asthma, sleep issues, anxiety, panic disorder. If it's performance, mental and physical, sporting and corporate, oxygenadvantage.com. So there's two arms, two sister organizations. And yeah, thanks very much, Dermot.
Mm.
It's been a pleasure.
Thanks, Patrick.